Oh, just trying to make it sound good.
Yeah.
Oh, that's a cute one. I gotta think of other words outside cute. I'll show it to you, but I know you need your glasses for it. It's all gone. You okay with that?
Oh yeah.
Girl, you. Let's see if that little one allows me to squeeze it out. Oh, yours are gonna be sticklers, aren't they? Let me see.
It's that tough
They
skin.
want to challenge me. Pinch here. There we go. See, they're like underneath there. I'm sure you've tried to squeeze them, and they are hard to do.
Yeah.
You got that one. It's like I can feel them. But you can't see them so well. Not even a budge. You're a trooper. That was a good one. First one was good. I think I have a couple more right here. You have very small ones, but so the good thing is you really can't see them very well, but you can feel them when you rub against your face, the bumpiness. So I think we're gonna have to do this a couple of times to just really try to localize them. There we go. To push down on your hard. Come back at this one here. I think I see one below it. And then there was a little smattering of them on her left cheek. Or, yeah, her left cheek that we're gonna try to get to. Sometimes I just like to ooze a little bit. That right there is a mole, but at least I feel less bumpies here. I'm going to have you, these little black little comedones. Down here first. Pressure. There you go. You know, we are giving you that retin-A, and that is actually going to be very important here. That's going to help to soften these up so that I can extract them a little more easily.
Oh, okay.
These are wanting to come out without a little bit of a fight at getting some of them, but I can see all these little ones here. I'm trying to get them, but they are stuck, and they've like planted their roots and they're just staying. But I do believe that the retin-A will help to soften them up, and that we can, let's see how that helps with us extracting them again. Like maybe going on retin-A for about a month. So that one came out finally. Are you okay?
Oh yeah.
God, you have a good, I mean, you're
It's a lifetime
tough.
of acne.
And you've had them extracted before or not really?
No,
Oh, really? There we go. Sometimes you just have to come back. Like when they're least expecting it. I feel like they have their guard up, and then sometimes you treat it once and then you come back again and they come out. There we go. Good. There's some bigger ones up here. I want it to ooze a little bit. There we go. So other than my pokes here, which are going to go away very soon, I do think this side looks better. We did extract about at least 15 or so over here, maybe 20 or so.
Wow.
So I think it's like I forget with you that you are, I swear when we do men here, they're wincing all over the place. But I always forget that she's not had any numbing and she's fine. You see how they kind of come out again, got them again? It's like they have to, the first time around, they say, oh no, and then I come back again and they go, okay. They pop out. Let's see, I want this one. It's like the fourth time I've bit here on the chin. And then I think we're pretty good. A little baby pinch here. It's like a little whitehead here on this side. So just little ones around here. I want you to use that Retin-A on yourself, and we'll come back at you again in about a month or so.
Okay.
But yeah, these are better. There were little dark ones when we came before. Now they look good. There, so I think this is a hardened blackhead right here. There we go. That one popped up nice and cleanly. Okay. There's one. That wasn't too bad. Okay. No speaking here. Doing great. Off here. One, that's good. There's a little one right next to it. I do believe it's a little deeper. You might feel a little pinch right here. Pinch. I don't know if I can get it. This one's a little more deep set. I'm going to try to buzz this one here. I'm going to come back to that one with our little buzzer. Okay, a couple over here on this far edge. These are MILIA and Whiteheads. They're deeper under there. You have to essentially nick the surface of the skin or you cannot get to them. There's no way you can squeeze them out. They're kind of in this little shell, like a little pearl, we call them, like a little bit of a pearl looking texture. I nicked it. It still doesn't want to come on. I gotta re-nick it. Go over there. I think that one. Come here. It's like slippery here. Let's try the other side. It's there, I can see, I think I can see part of it. There we go, it's right there. Come on, do one more nick to release it. There we go, got it. That one was it. Tough mother there. That was a tough one. You got it though. There we go. Let me just check to make sure. I do think we got it all. Okay, a couple on your chin. And then we're pretty good over here. A couple of the bigger ones here. Pinch here. So these tend to happen in people with sebaceous skin. They just have a lot of oil in their skin and they're paired with little more pronounced oil glands that you have as well. Just re-nick that one. That one wasn't satisfying. Let's see if I can't get those two. I'm not gonna do too much on you. I just want to get the biggest one because I know you have a weekend, like in a few days you're going to be going out with your girlfriends, so I don't want to do too much for you because these areas have a little nick in the skin. They will heal just fine just in a couple of days or under the skin a little bit because like I want to put a nice nick under there to be able to extract them. Good. One more time. pretty good. All right, now lastly, I'm just gonna buzz you. There's like one little buzz, one little pinch here on your cheek. But it can also help with these little blood vessels. See, if I just buzz them a little bit, I can kind of cauterize them as well. There. She has a couple oil glands like right here on her forehead. I'm gonna shrink them down a little bit. And then on her forehead here too, this is an oil gland. It's like a pink one with a central little dell. I'm just trying to shrink it a little bit. We have the tiniest milia here. There's milia here. Milia here. And again, I'm not going to do too much on you because we have stuff going on this week. I'm going to just check. And then a couple on the side of her nose here. These are oil glands. Pinch. We're not eliminating them. We're just trying to shrink them down a little bit. Okay. Oh yeah, this one here. This one that didn't want to come out completely. I'm just going to buzz inside there just to see if I want to shove it out.